Welcome back. October is Breast Cancer Awareness Month, and I'm joined now by Dr. Meredith Witten from Advocate Aurora to learn more about the signs everybody needs to be watching for. Thank you so much for joining us.
Thank you for having me.
So we were talking a little bit about this over commercial break. I mean, who qualifies for a breast screening? I mean, what are some guidelines that we should follow, and who should come to these?
Absolutely. So we want all women to start beginning some sort of mammographic screening at age 40. Everybody's a little bit different. Some people have a stronger family history, so occasionally we start earlier. So if you notice that a lot of people in your family have breast cancer, or there's something suspicious that doesn't add up, ask your primary care provider. But every woman, we want to start seeing us at age 40.
And what are some signs that you should be looking for?
So anybody should let us know if they have a palpable mass in their breast, any nipple discharge, especially if it's one side, bloody or colored nipple discharge, any skin changes that are not going away, such as itchiness to the skin, redness, or thickening to the skin.
And let's talk about the breast cancer genetic testing, because I think that really became popular. I think it was Angelina Jolie who first kind of made it popular, I think, and it's taken off since then. So for people who aren't familiar, tell us a little more about that.
Yeah, so a certain percentage of our breast cancer patients have a genetic mutation, which means something in their genes predisposes them to developing a breast cancer. And we do see that, however, it's not the most common way that we see breast cancer presenting. But certain things like breast cancer diagnosed before age 50 or with certain characteristics do qualify for genetic testing. And we are testing more and more people. And in addition to that, those people who have a mutation without a development of breast cancer sometimes do qualify for prophylactic surgery or surgery before the development of breast cancer in order to prevent that from happening.
And if, you know, let's say you have a parent perhaps who has breast cancer, who had breast cancer, what is the percentage, what are the chances of you as the child getting breast cancer eventually?
So unfortunately, there's no straightforward question sometimes, so it's a little bit of a complex answer. So it depends on when your mom developed that breast cancer. So for example, if your mom was in their 80s and developed a very benign breast cancer, that chance wouldn't be likely much more than the 1 in 8 we see every other woman to have. However, if your mom was in her 30s, 40s, or even early 50s and had an aggressive form of breast cancer that was more likely to be a genetically associated breast cancer, that would increase your chances. For the women who qualify for our traditional testing, we say that about 10 to 15% of those women will have a mutation.
And I think sometimes when we talk about breast cancer, we often think of women, but what should men be doing? What should they be aware of?
Sure, so it is a disease that does affect men, certainly a lot less than it affects women, but it's something we want men to be aware of. We don't send men for routine screening mammograms unless they have that strong family history. However, if they notice a lump in their breast or skin changes, a rash, anything that's not going away or doesn't seem right, we do want them to present, because it does tend to present later because they're not looking for it the same way women are.
And it sounds like, you know, the mastectomy trends have also been evolving.
Yes, we're actually doing less mastectomies than we used to in the past, but we have had some differences in how we approach mastectomies. You can have a mastectomy with or without reconstruction, so some people choose to have their chest flat afterwards. Other people have reconstruction either with an implant based or with their own tissue, so we can actually take tissue from a patient's stomach or back and recreate a natural looking breast.
Very fascinating. Thank you so much for your time and